Welcome to Keep It Healthy. Today we are featuring Kristina Cahojova, founder and CEO of Lady Technologies, creator of kegg, a fertility tracker that doubles as a pelvic floor exerciser. Kristina's journey from working on Amazon and eBay to launching a FemTech startup showcases her drive and innovation. After founding kegg in 2017 and overcoming initial fundraising challenges, she successfully brought her vision to life, earning recognition at TechCrunch Disturb 2018 and CES 2019. A strong advocate for women in tech and femtech, Kristina is inspired by industry leaders and is on a mission to expand kegg's reach, starting with Asian markets. Join us as we dive into her story of resilience, innovation, and her goal to revolutionize women's health. Welcome to Keep IT Healthy podcast, the show hosted by people making things happen in technology, aiming to optimize healthcare delivery, health, well-being, and fitness. My name is Jan Kamiński and I'm the co-founder of AppLover, a company dedicated to improving the quality of life with IT solutions and digital advisory. We started making this podcast to amplify great thinking to propel healthcare forward. So how did you end up in tech?
When I was in high school, I was thinking like what I want to do. There's a lot of pressure on us. Polish people have the same system as Slovak people. We have high school, then we decide which university we go to. And originally I wanted to do legal, but then I realized I would be stuck in Slovakia forever, so no. And then I was at the time I was leading high school magazine, and we had a column called What to Do After High School. So I personally visited a lot of universities and interviewed students. And the coolest students I found were studying business. So I was like, I will study business. That was the reason why.
Okay, but currently you live in the US, right?
Yes, I know. Boring.
No, but I mean, do you miss Europe sometimes or not really?
Very much. I miss it every day, I have to say. I have a lot of European friends, and I would say my friends are half European, half American. And we just have a very different mindset in Europe than Americans do. I would also say we're way more open-minded.
That was actually my question. I mean, because we have a lot of US-based clients, the difference in approach, what would be, especially in the startup world, in tech world, between American startups and European startups? What's your opinion on that?
So I know a lot of Slovak and Czech entrepreneurs. I know one Polish, and also, so I'm taking this as like our Central Eastern European region, because I think there's also difference between people from West Europe. But specifically to our region, I think that we are all brought up with the stigma that being unsuccessful is horrible. And what I like about Americans is that you try, you fail, and that's amazing. And people take this not being successful at your first venture in our region very seriously. And here's like, well, you tried, you felt wonderful. Now you have experience. Let's go next one. I have one investor in our company. He's on his fifth venture. 4 previous ones failed. And the same investors invested in his fifth one. And I really think this is the approach that I like more from American side and European side, because we take the attempt to try to accomplish something as something bad in case it doesn't work out. But it's not as like, wow, this person actually tried. And yeah, it's very difficult. But I really like it. And what I like on the European end is that we really do work hard. Like Americans work hard, truthfully. Nevertheless, I think us, Slovaks, Czechs, and Polish particularly, and also Hungarians, we work probably double that hard. I don't know if it's good or bad, but yeah, I think we have a lot of acumen, a lot of very good attitude to work towards work. And,
Yeah.
like we still can enjoy. It's not like Americans, like, hey, who are you? I'm my work, and there is nothing else. But we have we can work really hard and then enjoy life really well. And I really like it. Americans are literally like, you are what you do, and that's it.
hmm But I think, I mean, the failure in the United States is slightly idealized. I mean, the death of a business is a tragedy in a sense. Like people get fired, you don't get paid, you don't pay your invoices and everything. Like I mean, I
Yeah.
get the approach, but still, it's slightly. In my, I mean, at least that's just my opinion. But I mean, how out of all the industries and verticals, you picked FemTech, which is very hard but it's very challenging. But on the other hand, it's super inspiring. So how did you end up in this particular vertical, and what's the story behind Keg?
This is my second venture. I had a first company already at university, and actually, it was a good company. It won awards for logistics and business plans and who knows what, but the company failed. And I was reflecting on why there was a failure. And I identified two things. Number one was something that was completely out of my hand. I underestimated the hardship of logistics early on, which could have been overcame by having like larger investment, but an investment in that category in the region where I started was non-existent. So from the beginning, when you look at it objectively, it was deemed to fail. And second, I realized that the biggest problem in the business is that the business basically equals you in the beginning. You do everything. And it's very hard. Like, it's very hard for young people to have no salary, to see all their peers getting these corporate lovely jobs that pay all the perks and who knows what. And then you have to like scrape around everything, all the invoices, all the contractors. And this being so hard, if you do something that is not your passion, it's very difficult. Like, so I realized the second venture that I will do also has to be built upon my passion. That's something that I really enjoy. And even if I fail, I would say like, yeah, but I'm still happy that I tried because, it was a good mission. So I was like, I will do better market research. I will get VC funding early on. I will not start putting all my savings into something that cannot get VC funding. And third, it has to be my passion, because the passion is something that brings you over hard times, which are a ton in any business. And when I moved to United States, I actually didn't move because I had a company here, but I was working in tech in London. And my husband was also working in tech, and his company moved him here to San Francisco. So I came along and I was like, there is no better place to start a company than Bay Area. And I started to work here in the tech. I got experience, but I was always thinking, what I could be doing. And I was working in consumer facing tech, and I realized there was this huge need that was actually the same thing that I was going through, that we women don't have enough data on our intimate parts. It sounds funny, but the reason why I knew about it was that I got my period late as a girl, and I always had very painful periods. And when I was trying to fix my health here in the United States, I was told this wonderful advice by a reproductive endocrinologist that there is nothing we can do because you're not trying to get pregnant. And even then, we would probably, send you to IVF. But you know what you can do? Like, you can really try to track your cervical fluid, and that we can discuss what we can work with you, or like what we could change, and do it more in this holistic way. And I was like, cervical fluid, what? Are you crazy? Are you literally crazy? Like, give me the test, I will do it. And they're like, no, it's something you do at home. And to me, that advice was so shitty and so medieval that I started to think, like, when people have diabetes, do we send them home and tell them to smell their urine if it smells like too, like sweet, and they have a
Yeah.
problem? Like, what the fuck is this advice? And I realized it's not just me. It's like millions of women, and a lot of intimate problems are treated this like not a scientific way because we don't have access to vaginal data. And so I started to think like, and like my first employer here was a big tech company, and here it works in a way like people live in a city, or cool people live in a city, not in suburbs. And these big tech companies have headquarters outside of the city. So they pay for shuttle buses to pick you up in a city and bring you to this corporate headquarters, which is in the middle of nowhere. And then they ship you back to the city in the evening. And my shuttle bus stop was in front of sex store. And so every morning I was like, standing on the shuttle bus stop looking at that sex toys shop. I was like, like, why? Just why? It's so easy. Like we all use this. We all have fun. Why we cannot collect medical data in a user-friendly way? It's so obvious. But like based on my first experience, I was like, I don't do anything that cannot get VC funding. So I was like pitching it first to company to build an intimate device that could collect medical data. They were not excited about it because number one, it's hardware. Number two, it vibrates, so like big no-no. And number three is regulated because it's a medical device. So you have a medical device that is user-friendly. Like, of course, people thought it's crazy. And but I met this VC guy, and he actually got himself quite rich by selling sex toys. And he was like, that's genius. That's absolutely genius. I was like, okay. And so he wrote me the first check. And when he wrote me the check, I gave the notice and my work. And then I left to Asia to build it, to China, to quickly prototype and just try to like do it very quickly and see if it's actually feasible or not. So that's how it started. But I really thought that, you have to start companies that, like, you're passionate about, you can get VC funding for, but also like you really do really good market research and you see like the project has legs and it's possible. And on the market demand side, it was very obvious this is possible and women want. I did a lot of research. And honestly, who wouldn't want that, right? Like when you talk to women, it's very obvious. But when you talk to men who have money, like to them it's less obvious. So yeah, that's how we started. And then it was always really hard because men are people who have money, not women. So I really struggled with funding early on because they saw what their LPs are limited partners in a VC fund, like people who invest in VCs, and they have certain conditions what their money cannot be invested in. And it turns out anything intimate is a red flag that cannot be invested in. And anything that is hardware is a red flag too. And God forbid medically regulated and clinically tested. Like I realized I took all red flags that VCs hate. And I was trying to fundraise in the hardest category there ever is because I just created the category. But it's okay. Like we made it. We raised money, we launched, and since we launched, we are selling and growing. And the market proved me right. My users proved me right. So like we have revenue as opposed to most companies that need to fundraise forever. We have growing revenue.
You talked about this in the media about the problems in fundraising, and I get the argument that just that the VCs didn't really understand that. But how did you overcome that? I mean, what did you do to finally convince them?
Just by passion. Like just by passion. Like this is what I think was a good thing in the past that I learned. You have to have a passion because it's so difficult. It's so hard. If it would be something that wouldn't be close to my heart and close to my vagina, I would be like, I just give up. Like it's just too hard. But, we had a prototype. I was using it every day. And I was like, this is just so cool. Like it's just way better than anything else. And it's just people don't see it yet. So one by one, 10,000 by 10,000, 100,000 by 100,000, like slowly by slowly, I just made it. Yeah, it was really hard. Like I will not lie. The reason why it took me a few years to launch the product to the market was just because we couldn't fundraise enough. If we got the seed round closed the moment I had the prototype, right now I would have like $100 million in revenue. But because it took some time, we are earlier on, we will still have $100 million revenue probably in like a year and a half. But that was just the biggest hurdle. But at the same time, I am not really angry at that because people just didn't see it, right? Like you're either crazy or you're right. And I think I was right because now we have followers. So like what people didn't see when I started, like analogy with diabetes, like smell your urine is a stupid advice. And sending women home and telling her like sense your vagina is also stupid advice. So, they didn't see it. And now it's possible. And it's not just that, it's cervical fluid. There are physiological changes in vagina as well. So if you have a very user-friendly user experience and you use the same product over a certain period of time, you have one and only data set of how the physiology in vagina is changing. So you can feed this information for better pharma drug development. You understand conditions around menopause. You have like so incredible data, and you also know like which drugs actually work and which don't. And you also translate the data for women, so they go to doctors and they're not gaslighted like, hey, it's all in your head. Like, no, look, this is my data. And now people finally see it because we are starting to have a real traction, and it's wonderful. And also, the more we publish our science, the more medical establishment is interested, and the more they say, wow, now we can have vaginal data. Oh my gosh, this is amazing. So, like there's a lot of interest now in using what we have for healthcare, for research, for government grants, for many things.
Okay, and how does your product stand apart from other fertility trackers, and particularly in terms of tech?
Well, in short, it's the only product in the market that translates data from cervical fluid. The reason why most people use it now to help themselves get pregnant is because that's what people know this the cervical fluid to be used for. Like it really helps you get pregnant, and clinically and scientifically it's better than urine-based monitors or temperature. So there is a clinical validation to it that's far better. But also people get it, and research fields get it, is that it's not just cervical fluid data, like also physiological data in vagina. So what other things you can use cervical fluid data for? And it's vaginal stability, which is infections, and it's also avoiding pregnancy naturally, because the electrical properties of cervical fluid are widely used in contraception, but it are not used to inform women. So people are very interested in the product from the get-go, and it's in the form factor of pelvic floor trainer. So you help women exercise her pelvic floor before she actually conceives, before she's pregnant, and before there is any tremendous impact on her pelvic floor. So you have her baseline data on pelvic floor. So after pregnancy, you understand the difference. And that is a very, very, very big cost savings to healthcare, but also women understand the difference. And as the user experience hooked, and then brings you back to the product. And naturally you're asking more questions. So, once you get there in vagina, that you stay there, there are other things that you can do. And people will finally see it, and our users also see it, and once they got pregnant, they continue the journey with us.
With development of kegg, you mentioned hardware was a no-no at the beginning. Could you share some of the specific challenges that you faced in that development of both software and hardware, and how did you address them? And what also interests me is a particular FemTech challenges that might occur.
Hardware challenges, like the reason why investors don't like hardware is because most people have done it wrong. And most people try to do hardware without the thinking of scalability, like how do I scale this? So they create some kind of prototype in a lab, take it to factory cannot produce it, it's all wrong. But I studied also in Taiwan, and I am not a hardware engineer, right? So I just look at it as a business problem. So the way how I looked at it as a business problem was that I went to the factory. I was like, tell me how to, make this prototype right so you can mass produce it. Which I think like the hardware engineers in Bay Area just don't do. Like they do the best prototype ever in their lab, and then they're trying to push it on contract manufacturers. But no, I went to Asia. I basically almost slept in factory, and I was trying to make it right. And I think that was the biggest difference, that I didn't build it as a science research project, but I was like, what can be done? And so it's like launched to the market as soon as possible. So that was for the hardware challenge. And also I had one luck, which is that there is another challenge you have as a hardware startup. It's called cash flow. You have to put a lot into inventory, a lot into tooling, production, setup, like the first setup costs are very high. And I was like, I just cannot connect the two. Like, it's just so much. It would like consume $500,000 before you actually can have any sale. And this $500,000 is locked because then you have to do the regulatory, and the regulatory can take another half to a year. So you have to sunk the cost before you even know that you can sell the product. And so I started to look for contract manufacturers that could also become my investor. And I found one. And once the contract manufacturer became an investor, their interests align, and they help you with this cash flow challenge. So they fund for you the first product order batch, and it's in their best interest that it's the smallest batch possible and cheapest batch possible and very low churn. And this is what I have done right, because many people end up the challenge in like, hey, they pitch to contract manufacturer, they perfect hardware sample, which is like useless because it's probably good for research. And then these contract manufacturers look at it and they're like, my minimum order size is 10,000. And even on 10,000 on this prototype, I can earn like $5, like 100%. No, I'm not interested. And so like, this is where many hardware people fail, and they don't align their contract manufacturers with their interests. And these people are not interested in like helping you decrease the costs. They just want to earn on the operational line, like on the margins, and the margins in manufacturing are very slim.
You moved to Asia to do it, right?
Mm-hmm. Yeah.
And right now, currently, as I know, you're trying to scale in the Asian markets like Singapore and Japan. So what are the unique challenges of those markets, especially if you sell hardware there?
You have to have local contact. It's impossible without local contacts. The markets are very different. And I think what really helped me was, first of all, I wouldn't say like I'm a pro at Asian markets. I live there, okay? But I a little bit understand their culture better than just people who have never traveled or like have 2 weeks vacation a year and then go for 2 weeks to Japan. And when you understand like the completely different mindset of those cultures and you develop like good business relationships, then they introduce you to other people and the other people and other people. And there is one big advantage in Asian market. People don't realize it, but Japan, Korea, Taiwan, Hong Kong, Singapore, these economies will be double, in 10 years. And like, that's like European Union. And these economies have no competitors in our field, like even possible competitors in our field. Because the way how here investors thought like, oh my gosh, it's taboo, vagina and vibrations and who knows what. Those markets, like they just don't even think about women that much at all. In Taiwan, women can finally inherit automatically probably like in last 10 or 15 years. So the country is like very high tech, but all these like old weird tradition thingies were like leaping over forever. And so like there is a very huge opportunity because like women are getting richer there. The whole society is changing. Women have way more power, also economic power. And those markets are very, very, very good. Very good. And because Western innovations, they cannot operate in the market. If you are there, you don't have any competition.
Okay. And with this is let's say what's happening now and then trying to scale for the Asian markets. And you've been in the accelerating program. Could you say which one was that and how it influenced your business? You mentioned when was it? Was it before or after the initial funding you got, or they helped with the funding?
They help with the funding. That's the thing. Like they help with the funding. They actually required that they will put money in only if you move to China and try to prototype there, which is very smart. And it's very, very, very smart because this fund called SOSV is the largest early medtech, early biotech, and early hardware investor in the United States. And they have presence in Asia, in many countries of Asia. And they understand like if you can like do the manufacturing right early on, then you're way more likely to be successful down the line. And so it was pushed from their end, and I agree with it because most people have no idea how it works in a real factory. They have never been to a factory. So I spend a lot of time with them when they help you with prototyping, make the right introductions to contract manufacturers, and make introductions to people in your field that have done it successfully already. So there is a lot of knowledge sharing on one spot.
And did they invest as well? I mean, themselves?
Mhm. Yes, they
Okay.
did.
Okay. So the story was acceleration, VC, now scaling. You mentioned at the beginning that you're started sales. It's going well. I've seen you have over 20,000 reviews from the users, which is great.
Yep.
But what's the next step? I mean, how do you see kegg evolving in the next 5 years in terms of technology? Because probably it's way harder to change hardware. And the
Mhm.
market reach, you mentioned some Asia. So what's the plan?
So we are currently upgrading the product. We call the product sensor, with more sensors. So, sensors that would be able to measure more data from vagina. And we intend to launch this updated product to the market next year. The reason why we're doing it is because the more data we collect from vagina, the more we can translate, the more our company is valuable. And what we are doing alongside with it, we're pursuing more claims with FDA. FDA is a regulatory body in the United States which tells you this you can claim with a product and this you cannot claim. Right now, what we can claim with a product is to help women get pregnant fast. But I want us to be able to claim in postpartum recovery, like get your pelvic floor to where it was before you actually got pregnant. So that is the claim that we're seeking for. And then also use your cervical fluid data to avoid pregnancy naturally, which is like very apparent. And once we activate these two claims with FDA, we can actively market to women in postpartum and in between children. Because women who had troubles becoming pregnant, most of them, they blame birth control for inability to get pregnant. So they don't want to be in birth control at all. And cervical fluid is the only physiological secret from women that actually determines when sperm are dead, like when they can enter cervix and when they cannot. So it's the only tool that dictates our conception probability apart from ovulation, but ovulation aside, without cervical fluid doesn't make sense. And these electrical properties of cervical fluid have been used in modern birth control for a long time, like IUD, certain pills. And what these products have been doing, they were like maintaining the electrical properties of cervical fluid in an infertile stage so women can never get pregnant. But what my intention is like getting an FDA clearance for us saying now the cervical fluid properties are in a way that sperm cannot enter cervix. Now the cervical fluid properties are actually nurturing sperm, so you have to use condom. And when I give this power to women, of course they will not choose to be on IOD. They're like, oh wow, great user experience, condomless sex, and like no side effect from birth control. There we roll. And another big benefit from our form factor is that when you take care of your pelvic floor before and after pregnancy, your intimate life is way better. So you have stronger orgasms. So of course, this is a offering that many women would welcome.
You mentioned the sensing technology. Could you explain how kegs, and I know it's quite unique, so could you explain how that works and what are
Mhm.
the advantages for users?
Yeah, so currently the way how it works, it uses impedance. Impedance is like a sensing technology. Basically, in very, very simple words, even though this is not very correct what we do, but something that you can relate to from physics from high school is like it's electrical current that says like how many free ions are in a fluid around me. And that's in a nutshell what we do. But of course, like we're looking for different ions. And this is important because also sperm are wired electrically, and cervical fluid actually creates the path for sperm to move based on the conductivity. So this is what we measure, and we provide women when the changes from infertile to fertile happen, and about the fertile window, and then there is a pattern there around ovulation with conductivity that like you see like you have had ovulation. So that's one. And then what we kicked out from our first MVP, minimum viable product, was pressure sensor. So, we wanted to provide a gamified experience of exercising pelvic floor. But just to get to the market faster, I kicked the pressure sensor out from our prototype, and now we are putting it back in. So, like the pressure sensor will be there, and another sensor that we are adding is like a third electrode, so we can do like more complex impedance models.
You mentioned the patch at the beginning, and how do you see the product itself, and you mentioned the long term vision for that. And what's your personal story with an impact on women's health globally? I mean, and I know that there's been a personal journey and the challenges you faced in fertility, and you mentioned it at the beginning. So could you share that story?
Well, I really envision a world where we will look at a birth control as something so ugly as smoking in 10 years. Like, hey, you're on birth control still? Oh, are you crazy? Or like when you're trying to get pregnant and you don't understand the physiology of your pelvic floor, everyone will be like, what? You hate sex? Like, you don't like, orgasms? So I think, a lot of the pain and a lot of the struggles that women went through up until now will be seen as like horrible in 10 years. And the only way how to get around it is by giving women access to their bodily data through vagina. So I really can envision very realistically word like you're trying to get pregnant. Wonderful. Here's a kick, because we need your baseline of your pelvic floor. Because if you don't have the baseline, 15 years down the line, you will pee yourself with a weak pelvic floor because we just don't know like what actually happened. And same as, you want to get pregnant. Wonderful. Now is the time to switch off from birth control that is like altering your body because you cannot be on hormonal birth control for 20 years. Here's a solution. And the solution now is from vagina because that is what dictates our conception probabilities. But there are so many other tools in vagina that help us live a better life. And I really think the future is there. Like, we use bodily data for preventative healthcare. And I really want to help women with a part of their health with preventative data from vagina. And the only way how I see it is in a user-friendly way. Like, it will never become a mass product if you provide user experience that is painful or women hate it. Or, it's something that you're not looking forward to do. So I think like user experience is going to make it or break it for us to become a mass lovable product. And we also spend a lot of resources right now into rethinking the user experience and make it even better and gamified.
And what other female leaders in the business, in the femtech space? We've been having this series for a while, talk with female leaders in femtech, but which and who are the female leaders in health tech that inspire you, and what have you learned from them?
Yeah, so I always speak to women who are like further along than me, and I would say one of them is Alex. She's the founder of Dame Products, is a sex toy company that was the first sex toy company in the United States that decided to use biodegradable materials for sex toys, because sex toys go largely unmonitored, full of toxic materials that would never be used in any other product, but because it's sex tech, regulatory doesn't touch it. So we have a lot of carcinogenic sex toys running around, and she was a trendsetter there, and she said no, started to sell sex toys that were double the price, but with higher standards, and the market proved her right. Like, yes, women want to pay more to have something safe. So it's definitely her, and her revenues are mind-blowing. Really mind-blowing. They're so mind-blowing. I cannot comment on the internal stuff I know, but like a very male company wanted to buy her, the male company that represented everything that she standed against, like displaying women naked and who knows what. She was like, just no. And another company that I really admire is Materna Medical, because what they do, they provide at hospital solutions for women, medical devices that help with vaginal delivery. Vaginal delivery, the way how it's done right now, is very ancient. A lot of women have delivery problems. And so what I see is like one way to prevent intimate problems for women is actually decreasing these problems that women have at hospital. And so they create medtech that actually help less vaginal tears and problems with delivery for women. And I think they just got the FDA clearance for it. I really think they will be able to go public because, that's the way to go. Like, women want to have safe delivery.
And what would be your advice for femtech founders?
It's hard. Don't do it. Talk first to someone who has done it to get real advice, because most of the femtech solutions have been tried. And just like really talk to someone who is in the field and is successful, and they will tell you who has done it, what has been working, and etc. It's hard.
Okay. So how can it be changed? I mean, how do you think the tech industry can better support and advance the female entrepreneurs and femtech innovators?
No, they will not. What can I tell you? Like this is not a NGO society where people genuinely help each other. Like people try to make money and they try to make it an innovation. So now, like, no one has actually no interest in elevating women or anything. They just talk about it. But when you look at the numbers, like only 2% after all this PR effort by VC funds to fund more women, only 2% of all VC funds go to women-funded companies. But like
Okay.
exit, when you look at M&A, like they're like 1/3 are actually women-run companies. So you're like, the disproportion is like, you have to climb over so many hurdles that I think like then you're well more positioned to actually exit because you're almost there. But yeah, it's just like, what can I tell you? Like, it will not change. Like, it's not like industry that you can regulate, like labor market, like, hey, don't discriminate women. This is a private market, and investors invest in something that is familiar to them and something they believe in. And all investors are biased, and they all look for patterns recognition that they understand. And they don't understand what a female success looks like as opposed to a male success looks like. So that's why you're not getting funded, and it's not going to change. So no, I don't think it's actually going to change unless women become rich.
Okay, maybe
No,
that's the
there's
way.
no hope. Sorry.
Okay, and where, Kristina, and where our audience can find your product?
Yeah, so on our website, kegg.tech, that's our website. It's sold in the United States right now. We're hopefully starting to sell in Japan end of the year. And yeah, that's where we are.
When you'll be available in Europe, by the way?
Well, as soon as possible. European Union just changed the regulatory for all medtech devices. So there are a lot of backlog on all regulatory agencies. We were told that it can take 12 to 18 months just to get the approval.
Okay, hopefully. So I hope. I mean, you'll get that. You'll get that soon enough. Kristina, thank you very much for joining today. It was great to hear your story.
Of course, yeah. I would love to serve women in Europe. Every time I go home, people are like, bring me cake, bring me cake. So all my luggage is always full of cakes.
No. Stay in touch with us. Subscribe to our podcast, give us a like, comment, or share. If you want to reach out personally, you can find me on LinkedIn and Instagram.